Hello again, and finally, this is part 4 of the Bunion series. I've been answering questions, a lot of questions that patients have been asking me, and if you were interested to learn about bunions, check out the other videos. I may have answered the question that you may have, and if you have other questions that I haven't answered, even by the end of this video, leave it down below and I will get to it at some point. Alright, I'm the Fly for Doctor, I'm a foot and ankle surgeon and doctor practicing in Houston, Texas. It's the Fly for Doctor on Instagram, TikTok, as well as on YouTube. If you think that you've enjoyed the rest of these videos and I've given you enough information, please subscribe to this video. Subscribe to this channel. I'll really appreciate it. Also hit the like button and let's get into it. So, in this series, we're going to be answering some of the final questions that I've gotten so far that I have compiled. Alright, so the questions that we're going to be answering in this video is, are there any exercises that can help with bunions? At what age should bunions be treated? How common are bunions? And the last one, which I've kind of answered, what are the risks of not treating bunions? So we'll be answering those in this video, so let's get into it. So are there any exercises that can help with bunions? Yes, there are exercises that can help with bunions, and if you are interested in seeing those exercises, leave a comment down below and say, show me the exercise, and I'll create a video that kind of shows you some of the things that can help. Again, remember, we can't quite reverse bunions without having surgery. However, we could manage it. We can also prevent the progression of the bunions. So these exercises are going to show you how to prevent it and how to strengthen your muscles in your toes to kind of help them become stronger. So let me know if you want to see those exercises down below and I'll get with you on them. The next question I'm going to be answering is, at what age should bunions be treated? Now, again, should bunions be treated should probably be the first question. Like I answered before, there are a couple of factors. Is it just for aesthetics, which is totally fine as long as you know what the reason is that you're doing this. The next question is it hurting you? If it's hurting you and you are a young patient, maybe a teenager in middle school or high school, you could get it treated, but there are things that we look at again before we treat this bunions. So you can treat it as long as you are skeletally mature, meaning that you're no longer growing. Your growth plates have been closed. So let's say you are a young person that's watching this video and you have a bunion and it hurts. As long as you've reached skeletal maturity, you can treat it. Now, are there patients that can still treat it even without reaching skeletal maturity? Meaning, you may be 13 or 14 or 15 and it's really hurting you tremendously. Yes, you can. Now, there are different procedures that avoid the growth plate that still lets you grow in a normal range and fashion. We do generally like to wait till you've at least matured, but if it's hurting you and it's affecting your activities of daily living, that you can't walk the way you used to walk, you can't run the way you used to run, you can't play volleyball, basketball, run around with your friends, there are things that we can do to help. So you can treat it at a young age, even before the patient has reached adulthood or matured or closed their growth plates, but we like to wait generally. But if not, there are things that we could do. Next question I'm going to ask is, how common are bunions? Surprisingly, bunions are pretty darn common. I don't have the percentages, but I'll put it somewhere in the video. They're pretty common because a lot of people sometimes don't even know that foot abnormality that they have is actually a bunion. I've had people say, what is this bump here? What is this? And I'm like, oh, well, that is a bunion. So it's actually much more common than you know. Now, not every bunion causes pain, hence why not everybody seeks to solve that problem. But if it's causing pain and discomfort, for sure we can fix it, but it is definitely common. So you are not abnormal, you are not an anomaly, you are not a rare breed. It's common, and if you check at least 10 people, I'm sure like 2 or 3 will have bunions. Okay, the last question I'm going to answer is, what are the risks of not treating bunions? So like I talked about, if you don't treat bunions, can it get worse? And the answer is yes. And that's because if you have a progressive bunion, meaning like some bunions, they form and they stay where they are. They don't get worse, they just stop where they are and they're fine. And that's okay. Some bunions continually get worse. Now, in some cases like rheumatoid arthritis, hyperflexibility, where the foot is just moving in all kinds of directions, those bunions progress. And the worse they get, the pressure is getting worse and worse. I'm kidding, I digress. The worse they get, the more they start to affect other structures around them. We talked about how it could go under the second toe or over the second toe, push that plantar plate up, cause a bend in the toe, and that could cause further problems like corns, hammer toes, toe dislocation, and things like that. So Can it get worse? Yes. And will it get worse? Well, it depends on the kind of bunions that you have. Do you have to fix it? It depends on if it causes pain, if it's progressively getting worse, if it's affecting your activities that you used to do before, and things like that. So yes, a worsening bunion could affect other things and other foot structures. If you leave me, I could talk about bunions continuously. But the interesting and most awesome thing is we have a way to fix your bunions minimally invasively in our office and also in the hospital, depending on what type you need to have. Again, the most important thing is to get a consultation. We look at you, we evaluate you, we get an x-ray, and we look to see what is going on, what's causing the bunion, how is your toe, how is your foot, and things like that. And if you have, about a mild to moderate bunion and you want to get minimal invasive surgery, definitely hit us up. What is minimally invasive surgery? It's a surgery where we do minimal incisions, very tiny incisions, and we're able to do very minimal cuts. These work especially if you have a mild bunion. It's nothing too big, it's nothing too crazy. And this minimally invasive surgery that I say mild for is stuff that we can do in the office, meaning you don't have to be put under for it. You don't have to be under general anesthesia. You are awake. You understand what's going on. You hear what's going on. We can talk to you. You can talk back to us. You're just kind of relaxing. You're walking right away. You come into the office that day. You walk right out of the office that day. There are no screws or hardware, and everything is going to be able to be beautiful and give you the aesthetically pleasing look that you want. Okay? Now, we also have minimally invasive surgery that we can also perform where we need screws and things like that when you're more of a moderate bunion. So if you have a moderate bunion, we can still do minimally invasive surgery where you have minimal scarring, minimal incision. You don't see it, it's still aesthetically pleasing. We do have to do hardware to keep it and hold the correction so it doesn't come back like we talked about, but it's still a good minimal invasive procedure where you don't have to stay off your foot as long as we talked about earlier, but you're still able to get back into your activities and things like that. And then, of course, we have a normal bunion surgery where if you have a very, very severe bunion, we have to fix it. We have to move things around. So you may see a little bit of a scar in that situation, but again, we need to have a consultation. So if this is something you're interested in getting, you have a bunion, you have pain, and you're concerned, give me a call. My phone number is down in the link below. Also, visit the website and book an online appointment. We can also do virtual appointments. If you want to send me a DM, you can send me a DM on Instagram, on YouTube, or on TikTok. It's still the Fly Foot Doctor. Share this video with your friends and family. They may have questions, and I think hopefully I may have answered it in any of the parts of the Bunion series that we talked about. But if I haven't, leave the question down below, and if I'm able to answer it, I will. All right, so next time is the Fly Foot Doctor. I'll see you later. Take care. Bye.